Sheikh, tell us about the logic behind lockdowns. Now, lots of experts say that just like previous outbreaks, the influenza, 1918 Spanish influenza, people will get it, and so therefore, what really is the point behind lockdowns? Is it to sort of secure the healthcare systems where they exist, not allow them to collapse, dealing with the worst case scenarios?
So it's interesting that you mentioned the 1918 pandemic influenza, because in fact, lockdowns are what minimize the impact of that influenza. If you look at cities in the United States, the choices they made about how quickly they went to quarantine and lockdown actually determined how severely affected they were by the influenza. So in fact, the 1918 pandemic shows that it's an effective measure for containment.
Okay, this is interesting because I'm reminded of this graph, which was, one side of the graph was about Philly and the other was about St. Louis. And it seems that in terms of flattening the curve, the early sort of social distancing in St. Louis helped flatten it quickly, whereas in Philly, it just soared much above as far as the graph is concerned. So that means that social distancing is required. But then here's the question. There's a huge difference between 1918 connectivity, even at individual levels, and what we have now in 2020.
That sort of cuts in two directions. One of which is that individual people may have many more social contacts and many more opportunities to spread the virus. It also means that when people are using social distancing, or even when a government has to go to quarantine or lockdown, people have more opportunities to continue to connect to each other virtually. They have the technology that you're not alone in a locked ward. You can still talk to your friends. You can still connect with the outside world and know what's going on. So in many ways, being in quarantine, being in lockdown is a less dramatically isolating experience now.